Hey everyone, welcome back to the channel. Today, we're diving into something that affects millions of people around the world, ADHD or Attention Deficit/Hyperactivity Disorder. Whether you're a student, a parent, a teacher, or someone wondering if you might have ADHD, this video will break it down for you in just 6 minutes. So, what exactly is ADHD? ADHD is a neurodevelopmental disorder that affects a person's ability to pay attention, control impulses, and manage energy levels. It's not just being hyper or easily distracted, it's a real brain-based condition that can seriously impact everyday life if not properly managed. The exact causes of ADHD aren't fully known, but scientists agree it's a mix of genetics, brain chemistry, and environment. Genetics play a huge role. ADHD tends to run in families. Differences in how the brain develops, especially in areas linked to attention and impulse control, are also linked. And exposure to things like tobacco, alcohol, or stress during pregnancy may increase the risk in children. ADHD is actually one of the most common mental health conditions in kids. Around 5 to 7% of children globally are affected, and in the United States, it's close to 10%. And here's something important. ADHD doesn't magically go away with age. In fact, about 60% of children with ADHD continue to have symptoms into adulthood. So there are 3 main types of ADHD. First, there's the inattentive type, then we have the hyperactive impulsive type, and finally there's the combined type, which by the way is actually the most common. For the inattentive type, some of the symptoms include having difficulty focusing, losing things pretty often, making careless mistakes, and being easily distracted. Now, if we're talking about the hyperactive impulsive type, you might notice constant fidgeting, talking non-stop, trouble sitting still, and interrupting people or acting without thinking. It's important to remember, ADHD looks different in every person, and girls are often underdiagnosed because their symptoms might be less disruptive or more internal. So, ADHD isn't diagnosed with a blood test or a brain scan. It's really based on behavioral assessments and clinical interviews. Doctors, psychologists, or psychiatrists will usually ask questions about a person's daily life, school performance, relationships, and a bunch of other things. For a diagnosis, symptoms have to be present for at least 6 months, show up in 2 or more settings like school and home, and actually interfere with normal functioning. Oh, and it's also super important to rule out other things like anxiety, learning disabilities, or even trauma. It's the whole family, and support at home is key. ADHD isn't a weakness, and having it definitely doesn't mean someone can't succeed. Actually, a lot of people with ADHD are super creative, energetic, and driven. But getting the right diagnosis and support can make all the difference. So if you or someone you know shows signs of ADHD, don't ignore it. Talk to a healthcare professional. Early support honestly changes lives. Thanks for watching. If you found this video helpful, give it a thumbs up, subscribe, and share it with someone who might benefit. And hey, drop a comment below if you want us to cover ADHD in adults, parenting tips, or study hacks for ADHD. Understanding ADHD can really help change lives. And don't forget to subscribe for more mental health content.